are you all doing? Excuse me, I'm sitting here looking at my notes. One, because I'm doing this because this is just a call for me to sound the alarm and blow the trumpet so that we can all be prepared. Listen, you all, I am the pastor of the Soul Factory here in ATL and in Washington, D.C., Maryland, and all that kind of stuff. And this is not what I planned to do until I had the crisis moment. And as long as you watch the new Ministry of Health, you'll find out that every one of us have a crisis, or someone has a medical crisis coming to their family. And I did not understand. I had watched the last lecturer. His name was Randy. And he had pancreatic cancer. And in him having pancreatic cancer, he had to make a decision of how he was going to go through. And he told the story of what he and his wife had gone through. And that was the first time and this is way before I was ever diagnosed with cancer or anything. I just read it to understand his story. And I had no idea that I would one day have a bout with cancer, lung cancer and then brain cancer. And what I found out, one of the most important people in this system is the gatekeeper, the caretaker. Because everyone is paying attention to the person who is hurt or the person who is ill, but no one really pays attention to the gatekeeper, the caretaker. And when you find out, you realize that all over the world, the mother is normally the gatekeeper of the family. In every culture, when it comes to healthcare, the mother is the gatekeeper of the information. Well, guess what? Today, I have Jaime Lavesseur. I'm going to let her say some of the things that she does, but I call her my first Tiger Mom live interview and person I met, because I only got to hear what the media would say about Tiger Moms, which they were talking about their assertiveness when it comes to taking care of their children and their aggressiveness. Well, we're about to be blessed on this new Ministry of Health because we're going to talk to the gatekeeper, because you gatekeepers know the same thing that I know. This system is broken and we're being abused, and we're all in the same boat. And listen, when I say abuse, not by people who don't care, but by a system that is designed not to totally fulfill every one of our needs. Okay, I've taken enough time to set that up. I'd like to welcome you all and meet I was going to say Dr. Jaime Lavesseur. She might as well be, because she's learned everything. And so today she's going to be Doc Lavesseur because she too knows this system. How are you doing?
I'm great.
Good to see you. Thank you for coming out. And I want to thank you. And anything I just said about that, when I said the system is broken, what was going through your mind?
Yeah. It was broken for myself.
Okay.
Yeah, for myself and for my family. I felt that it was broken, and I was looking for answers.
So now give me this. Let's pull them in so they understand a broken system. What is it that you were experiencing that you needed the healthcare system? And then you're a nurse too, right?
I am a nurse, yeah. So I work in the healthcare system also. So I know how to navigate it, but I wasn't getting the answers that I needed, and so I needed to kind of go off on my own and find answers that I wasn't finding.
What kind of answers did you? And I guess as a mom and a nurse, this has to be very frustrating.
Yeah, it was. So just to give it a little background, my daughter had a abdominal issue, and it was being diagnosed as IBS. Right,
okay.
Irritable bowel syndrome. So for years, this is what I was hearing, and we went to specialists and pediatric, specialists. And
what was her age?
She was 8 years old when this whole journey started, and I was just given a multiple of different medications to give her, and I kept looking at it as that it was a Band-Aid, Band-Aid to her symptoms. And I was given the diagnosis of IBS, which I knew as a nurse was like a really vague diagnosis. It was kind of like, we don't know really what's going on with her, the root cause. So I'm all about, let's find the root cause of what's going on and let's fix it, and I was given another vague diagnosis of, stress can be causing it. Well, everybody has stress in their life. I just wasn't willing to take that as her final diagnosis and to just medicate and Band-Aid or mask the different symptoms that she was having. Because I also knew as a nurse that a lot of times there's polypharmacy where we just over-medicate, one medication and another medication is given for the side effects of the first medication. Before you know it, you're up to 12 pills a day or something like that. And at such a young age, of between the ages of 8 and 12, I guess we were going through all of this with her. I just didn't want to set her up for a lifetime of medications without truly knowing what was causing the symptoms.
Okay, and let me ask you about how many pills, and I'm assuming they just kept wanting to prescribe pills?
Right. So, for instance, one gastroenterologist, we went and we said, well, she's constipated. She has severe stomach pain. So she was given, a medication to so that she could go to the bathroom.
Right.
And then, we would have to back off of that. She was given another medication to slow the bowel, one to help her go to the bathroom, one for the pain. And I just felt like it was like kind of this rabbit hole that, we were going down. It was one medication to counteract the other medication. And really all I was trying to do was figure out what was causing the pain.
Right. Well, let me ask you this, because again, remember, and you're a part of the new Ministry of Health with Beacon Holistics because you made a decision as you went through this. It became your call to help people with pain too, right?
Absolutely. So I started Beacon Holistic because I wanted, for anyone, but really I wanted to reach out to other parents that were, experiencing the same frustration that I was with my own daughter, with my child, because as a parent you feel as though your hands are tied, and that you can only listen to the medical doctor. But as a mother, you have a gut instinct and that mother's intuition, and I just kept following that. And it was difficult because a lot of times I had a lot of naysayers. Right. And the approach that when I would question a doctor, well, what about nutrition? Well, they kind of just brush it off. And that's not all doctors. I'm not saying that. Some are very educated on nutrition and really encourage it. The ones that I encountered personally really didn't put a large emphasis on it.
And how did you feel? If you go to, I just want people to understand their caregivers and caretakers are watching you. But what do you go through within once you hear that information and you're already equipped with some information? How do you feel?
I felt like I should have been guided more towards the route that I wanted to go.
Okay.
So they knew I was very vocal when I was in doctor's appointments that I wasn't happy with just medicating this child, and that I wanted to try different natural approaches first before getting really aggressive with, say, opioids, things of that nature. And I felt like almost a little bit brushed off.
I want to ask you, I'm sure when you questioned them, they treated you with kindness and understanding and gave you...
No.
You said that too fast.
No, because when I questioned, I was made to feel like I wasn't as educated as they were, and that they knew better, and that if I wanted my daughter to get better, that I better listen to them.
Right.
And I questioned a medication one time for a skin condition. Because the stomach issues really came out in all sorts of different ailments in my
Right.
child over the years, from skin conditions to brain fog, you name it, arthritis, all sorts of things. So it wasn't just the stomach.
Right.
It really was systemic with her. So there was one medication, I don't remember the name of it, for some eczema-like,
Mm-hmm.
and I brought her to a dermatologist. He prescribed it. He said, try this. I got home and I looked it up on the internet, and I saw that it was black boxed, which basically means that the government is saying, it is approved for use. However, it can cause side effects, cancer and things of that nature. So I said, well, I'm not comfortable putting this on her. If
Wait, hold on, Jamie. Let me ask you a question again.
Sure.
There's a term called black box.
Yes.
It was black boxed.
Right.
And they're saying it'll help, but it'll also possibly cause cancer or some other side effects.
Correct. Yes. So they're saying
This is mind-boggling, but go ahead.
use it with caution or under the guidance of your doctor. So they're basically saying that it can cause cancer. And I wasn't comfortable with that because
You shouldn't be.
because eczema is not life-threatening. So say, it was something life-threatening, acute at that time. Okay, fine, we're going to do whatever we need to keep this child alive. But it was eczema. So I said, no, I'm not going to put it on her. I'm going to wait, and I'm not going to bother the doctor with a phone call or anything like that. We have a follow-up. I'll go back in the 2 weeks, and I'll discuss my concerns with him. When I went in for the appointment, the nurse said to me, how is she doing? I said, well, she still has the eczema. I wanted to talk to the doctor about the medication he prescribed. And she said, well, have you been using it? And I said, no, I haven't. She says, well, no wonder why she's not getting better.
So you just go ahead.
So needless to say, we walked out of there. I did not go back. That wasn't, I did not feel as though my concerns were being addressed. And I really feel that every parent's concern should be addressed. And that's all I wanted. I wanted to be able to discuss those concerns. And again, let's try something maybe not as invasive. Your first line of defense to combat this eczema was a medication that can potentially be harming to her. So why can't we try something a little, less invasive, something natural, And then on the other hand, I've had other doctors who were like, have you tried wet wraps on the eczema? Which we did, or bleach baths, or something that wasn't quite as invasive.
Right.
And when you're talking with a family, you really have to go by their lead. Like,
Okay.
this doctor saw that he had a mother in front of him that was more conservative, that wanted to go a more natural route, and he wasn't willing to compromise with me.
Let me tell you something. It's sad, but I'm glad you're sharing that. Although, and we don't demonize the healthcare industry because we need doctors.
Absolutely.
But when I went to the hospital, I'll just tell the truth. I asked the guy, they give me a spinal tap. And they tell me I had cancer cells in my spine. And when they tell me this, I ask him, because I knew I had done him for the lung cancer. I said, and when I say I'm talking about terpene for lung cancer, and I asked him, my oncologist, I said, can I go ahead and try the natural path and to do this? And he looked at me and said, if you want to die, go ahead. I couldn't believe that the man who was the head of the oncology department told me straight up, if you want to die, then do that. Right then and there, I made a decision. I can't have any more conversations without my wife present.
Right.
Because when I went to another practitioner, he looked at her and told that, I think it's psychosomatic. And here I was saying, there's no way, sir, that I would make this up. And I'm saying, what's happening is as if you've got 5 minutes to see me. and you're rushing me out. And then I walked away, I kid you not, with 2 bags of medication. So my wife had to say, sir, this is, as the gatekeeper and the caregiver, she had to say, sir, it's not psychosomatic. And then after a while, I had to tell my wife, I don't want you to come to the appointments anymore. And the reason I told him that, you guys, is it was so stressful for the caregiver. And I said, I'm going to have to let my sister or someone else go because I didn't want to put too much more on her because she's also taking care of me. Did you feel some points where you felt like you wanted to quit?
Yeah, absolutely. And this is important for other parents to understand because, you know, there's no right answer. I don't have all the answers. No doctor has all the answers. I was just treating my daughter what I thought was best for her.
Right.
Right. And that could be different for somebody else we'll keep talking about this, the gatekeeper. So that, and I really love that title for myself.
Why?
I wear it with pride because I really am the gatekeeper of my family.
Okay.
Right. So my husband, myself, you know, as the protector of our children. But I'm the gatekeeper for my grandmother, for my husband, my children, even some of my friends look to me to be their healthcare gatekeeper, basically.
My goodness.
You know, but as Julia's gatekeeper, and her mother, I'm there to protect her.
Right.
You know, and I didn't feel I was getting the support that I needed to.
Right.
To be able to take care of her, you know, the right way. I felt like the power was being taken away from me. And that's another subject that, you know, that we've talked about.
Right. Let's go to that now. But I'm sorry, did I cut you off?
No, I'd love to.
I wrote in one of my notes that one of the things that as a patient and my caregiver wife and my sister who jumped in to help too, is that we had to learn, because what you said, power, but we had to learn you have to keep moving forward.
Right.
And you and I have come up with an understanding you have to take action.
Right.
Right?
To control the fear that you may have. You know, we're all fearful of the unknown, and it goes back to that when did I feel like I wanted to give up? Not give up. I'll never give up as a mother. But did I question whether I was doing the right thing all the time? Of course. Who doesn't question whether what path they're taking is the right path?
Right.
So, you know, sometimes if I saw her in pain, you know, I would say, oh my God, should I just bring her back to the doctor and have them give her the opioids to stop the pain, you know, right then and there? You know, because I just wanted to see this child, but I followed my gut. I wanted to see her without pain, I was going to say. But I followed my own gut and said, that's not going to help anything. I mean, it'll help it right now. Yes, give the child, you know, some really strong pain relief, but it's not going to fix the problem. And I knew that my mission as her mother was to not fix her. I'd love to fix her.
Right.
But to give her a path where she can live, you know, a healthful life, basically, without the opioids or damaging pharmaceuticals that I knew over long term would, you know, damage other organs and things of that nature. So yes, did I have moments where I cried and said, God, am I doing the right thing? But I always went right back to, you know, yes, I am doing the right thing. I'm going to stay on this path and we're going to get through it. And maybe it took it a little bit longer, but in the long run, absolutely. You know, she's a thriving young lady now.
And her age is now?
She is almost 18, and she's thriving. She's in college with a 4.0 average.
Come on now.
Yep, and she, you know, she does normal teenage things that she wasn't able to do a couple of years ago. And really, you know, we were able to do that, thankfully, without having to use medications. And I'm not against medications, and actually somebody that we're going to talk to later on has to use both pharmaceuticals but she also used homeopathic.
Right.
So she uses diet and nutrition, exercise, meditation, daily affirmations, which I love. You know, so she's incorporated both the allopathic and homeopathic ways of life,
Right.
which is something that we discuss a lot, the importance. And I find too often, because you experienced it, I experienced it, where the allopathic or Western medicine will dismiss the homeopathic altogether. And I'm not saying use only homeopathic or only, I think there has to be a beautiful marriage between the two. There's nothing wrong with taking a pharmaceutical drug, but also supplementing your lifestyle with nutrition and other homeopathic means.
I'm so glad you're saying this, because when I began to study and I'm sitting in the room trying to figure out what's going on, I found out that during the 1930s, 40s, about the 1930s and 40s, there was a medical schools. There were roughly 2,500 medical schools in the United States. And then there was a big takeover of the medical schools. And the medical schools became pharmacology schools. So my daughter, who was a pediatrician, she says, "Dad, you know more about natural medicine than I do." She said, I think if I took one class, I don't think I took one class on nutrition. And so I know that when we say take action, we also look, you said take control, and we have, what you're saying is you got the information so we don't become victims.
Right. Yeah, absolutely. It's really about knowing that there's other paths. There's other paths out there. And you know, what's wrong with using some meditation, you know, and meditative music to decrease somebody's anxiety and fear, which also brings down pain receptors or perception of pain. You know, why can't we, if that's what the patient wants to do, to try to use that instead of just popping a pill? But then on the other hand, you're going to have people that are like, I'm not interested in that, and I just want the magic pill that's going to take all of the pain away.
And that's why, go ahead, I'm sorry, I cut you off.
It's a health choice.
That's it. I'm shaking my head because I'm laying in the basement for 6 to 7 months, and I can't leave the basement. I'm in the dark. I lay on the floor because I don't know why I felt comfortable on the floor. And I had the worst headaches. And I know we've talked, you've experienced this, where you're driving and your child is in the back and they're doubled over in pain.
Right.
Well, I was in the back, and my wife and my daughter is taking me to 2 different places, and I lost who I was. And my way of taking control was deciding that I was going to put forth a plan of action. And that is, I'm going to find out what's going on. When that doctor told me you were going to die, I said to him, he said, if you want to die, I made the decision right then and there. I will no longer be a victim of this system. And then he called me back, and they called me back, and they were trying to get me. And then listen, you all, I'm not telling you not to do what the doctor is telling you to do. But the patients who survive are the ones who take a stand and ask questions and say, please tell me why this is happening. And I looked at the doctor and I said, but they told me I had an EGFR mutation gene, which meant I wouldn't have to take chemotherapy. I wouldn't have to take radiation. And they said, well, sir, we want you to do that just for preventative measures. And I said, but won't that create onset dementia? Won't that do that? I said, if you tell me I'm not presenting like I have this, well, shouldn't I go with the way I'm feeling? And then I realized they were jockeying for who was going to be able, the 2 hospitals were fighting over me, and who was going to be able to get the treatment.
Right.
And I had one doctor. God bless you, doctors who have a human touch. Bless you. Because when we walk into this no man's land, we need answers. And we need someone to say, it's going to be all right, and I'm going to give you all the information that you need. And let me tell you something. I left there, came home, and took control of my life and got on natural food products, along with allopathy, got on natural food products. You remember when you first met me, I could barely walk, keep up. I could barely keep my thoughts going. But this terpene oil, all I can tell you is it gave my life back. It gave my life back. And this is why I'm sounding the alarm. Because I couldn't think. You may see when I do this show, I have a couple of short-term memory things through some side effects here and there. But my cognitive function was back because I had decided you have to navigate the healthcare system with a tool. We'll talk about it at another segment, but secure my medical records. Now listen, I'm 53, and I want you all to understand. I know some of you all are very proficient on technical stuff like this, but I just decided that I was just getting too confused trying to look at this. But secure my medical records, I realized, I just found out what WAZE is. I kept seeing WAZ, WAZE. I was like, what is this about? Well, WAZE is an app that helps you navigate the traffic, navigate which roads, which neighborhood to go to give you the shortest routes. And the Secure My Medical Records is like a WAZE app where you have all your records. Listen to me, guys. As a mother, as a gatekeeper, you don't go to urgent care and now you're waiting for 2 hours to get your records and you're waiting to figure out what's going to happen. We are supposed to own our records. This gives us our right. And when you get to secure my medical records, look at the articles that are out right now. It's now a law that they must give us our records, not just in a printed form, but in a digital form. Had I had this, had my wife had this, it was so hard to remember what I was on every time I walked in. And I'm sure when you walked in, you had to fill out forms.
Right.
And you had to know every time, right?
Yeah, yeah.
And what did that do to you? And how would the Secure My Medical Records have helped you?
Well, especially dealing with both allopathic and homeopathic doctors that don't really speak the same language all the time. Having all of Julia's records in one place would have been so helpful for me. It really would have been, because instead I was trying to piece together history.
Right.
Because the doctors don't just offer up those records. I had to request them, and it had to go to another doctor. So having them in one place, obviously, for me to have access to them would have been very helpful.
Okay. Listen, I know we're going to do a lot of talking. We're both not professionals at this, guys. We met on Christmas Day 2018 because we were gathered. We called ourselves the unusual suspects because we just all have a passion to help people, to equip them. We're going to come back and talk about it, but the body can only handle pleasure, pain. And what was the other thing at the same time? Pleasure, pain, and what? Where is it at?
Fear.
And fear at the same time. And it can only handle these things. And some of us, we're so caught up with pleasure that we don't want to take the time to deal with our own health. The new Ministry of Health is giving you the power to take back control of your health and not just be a slave to this healthcare system. I appreciate you coming on.
My pleasure.
These segments are so short, I'm going to talk to the producers and say, y'all got to give us some more time. But I thank you for talking about it. And let me just ask you one more thing. What would you want the system to know, for people to know about being a gatekeeper? If you had to have one parting word, what would you look at the camera and tell them about the gatekeeper? And what do they need to know?
That we need to take control of our health care. We need to take responsibility for ourselves and our family's health care.
Okay. When you do that, you'll have peace of mind. I'm still in my trial, but I got help now. And what this medical concierge service on Secure My Medical Records and the terpenes and all the different things, it changes people's lives. I thought, you all, my life was over. And I said, I'm not going to do, I think I've done the best work I'm ever going to do. Right now, this is the best work. And I'm grateful for all the founders of Secure My Medical Records and all the doctors who have tutored me and helped me, and Dr. Robbie Lawrence. And if you want, give out your website so that people know what website to go to.
Oh, beaconholistic.com.
beaconholistic.com. And for me, if you see my tag, I work for Soldiers Outreach, soldiers-outreach.com. And you know what we do with all the terpene donations and stuff we receive? We feed children. It's called Kids Eat Free. So I want you all to understand, even if you're watching this and you want information even on Secure My Medical Records, send us your information. Send it to us by email, and we're going to send you information, and you'll get to try it out for free. Why? Because this is a patient advocacy group where we stand for the patient, and we don't take no money from other organizations. Why? Because we don't want to have anybody control our decisions. Once again, I thank you for being very transparent. I can't wait. Well, I guess I'm going to have to wait for you to talk to the next guest that's coming on.
Yeah.
But I appreciate you. And I thank you for helping me, because what you did was you helped me understand my wife. Because you can get tired. And I guarantee you, as a caregiver, sometimes you just want to disappear. And a caretaker, am I right or wrong?
Yes.
Okay. We'll talk about that in another segment. My name is Deron Cloud, and I am part of this movement to wellness, and everybody else. We all need to come together right now over love and truth. My name is Deron. I love you, and I beat you to it. Dr. Lavesseur, I'm speaking it into existence. I thank you for coming through. And we hope that we helped you with some wisdom or something to help you have a better, prosperous life. Much love. I love you, and I beat you to it.